Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 203,688 confirmed cases of COVID-19 in Canada and 65,896 cases in Ontario. Chatham-Kent has 378 cases and Sarnia-Lambton has reported 365 cases. Michigan now has 149,392 cases, with 15,027 cases being in Detroit. Today, we are happy to report that there are no cases of COVID-19 in Windsor and Essex County. We have had 2,774 cases since March. 2,662 people are now resolved and 36 cases are active and being followed by our health unit. 3 people are currently in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are no long-term care or retirement homes in outbreak at this time. 3 workplaces remain in outbreak, 1 in the agri-farm sector, 1 in construction, and 1 in the food and beverage industry. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit the number of contacts. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering if you cannot maintain a 2-meter distance from others. Avoid touching your eyes, nose, or mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. Download the COVID exposure alert app at canada.ca. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Unfortunately, I can't do my happy dance, but I would like to do it, looking at the cases that we have seen, so no cases. It's a great news. And hope that we can keep it that way. In addition, we continue to receive many questions related to travel and travel restrictions. Travel restrictions are an important and sometimes necessary public health measures used in combination with other prevention efforts, such as physical distancing and mask use, limiting the spread of COVID-19 and flatten the epidemic curve. At the beginning of the pandemic, many of you recall the majority of our cases were associated with travel outside of Canada. Once travel and border restrictions were put in place, we slowly saw a shift in this trend and we stopped seeing cases as a result of travel, but because of the spread that's already happened, we have seen more and more cases of COVID-19 among close contacts of a confirmed case. The Public Health Agency of Canada monitors risks to health associated with travel to other countries and determines a risk level to alert travelers and Canadians to potential health threats. Public Health Agency of Canada has deemed all travel outside of Canada to be at a level 3 warning, which is avoid all non-essential travel outside of Canada. During the pandemic, this same recommendation should be applied to all travel. While there is currently no requirements to isolate or restrictions for traveling within the province of Ontario, I recommend, as I have since from the early in the pandemic, to limit travel outside of Windsor-Essex whenever possible, especially to the hotspots such as Greater Toronto Area, Ottawa, Montreal, etc. Given our close proximity to the US border, we continue to receive and respond to questions related to the rules around the Quarantine Act. To provide greater clarity, anyone, regardless of symptom, who's coming into Canada by land, air, or sea, is required to isolate for 14 days under the Federal Quarantine Act. As well, the border between the US and Canada is restricted to all travel under the Quarantine Act with limited exceptions. In few cases, individuals may be exempt from the requirements to quarantine. Exemption from quarantine are extended to specific persons such as crew members, members of the armed forces, persons or class of persons the Chief Public Health Officer determines and that provides an essential service, persons permitted to work in Canada to provide essential services and who enter only to provide those services, a licensed healthcare professional with proof of employment in Canada. In all cases of exemptions to quarantine for the purpose of work, it is clearly stated that in the Act that this is related to an entry or travel for the purpose of performing essential duties only. For example, a healthcare worker provider that travels outside of Canada for personal reasons and is only re-entering to return home is not requesting entry to perform their essential duties, but is rather returning their home. In such cases, they are subject to the Quarantine Act. Mandatory 14 days isolation under the Act begins on the day an individual enters into Canada. Individuals cannot end the quarantine early, regardless of being tested for COVID-19 and receiving a negative test. Any person exempt from the Quarantine Act, for example, essential work purposes, is required under the Act to wear a mask or face covering in public settings where physical distancing cannot be maintained. The 14-day isolation period is to limit any potential transmission of travel acquired COVID-19. When someone is exposed to COVID-19, symptoms can develop at any point during the 14 days incubation period, but on an average, it appears by the 4th or 5th day mark after exposure to an infectious person. Any person in self-isolation who develops symptoms of COVID-19 should be tested immediately and follow up with a medical provider. For those subjects to the Quarantine Act, direction for quarantine is given at the time they enter into Canada. For individuals crossing the border daily for work, should consider work from home if this is feasible. While in the US, workers should wear a mask or face coverings at all times and only travel directly to work. They must avoid shopping, running errands, or other non-essential activities while on work-related travel privileges. For services in Windsor-Essex, you should not decline services to the essential workers traveling to Michigan, but instead use all the appropriate precautions, including active screening, face coverings, or masks, depending on the nature of services. These workers are being truthful to you by disclosing that they are essential workers to your benefit so that all the appropriate precautions can be used. Not allowing them services could lead them to hide that information and potentially miss an opportunity for protection. Therefore, I would request you to take precautions instead of declining services to them. To read the quarantine order, please visit the Government of Canada webpage. To learn more about restriction, exemptions, and enforcement of the Quarantine Act, contact Canadian Border Services. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with CBC.
Hi there. So we saw the Windsor Regional Hospital say yesterday that they were going to start reducing hours at one of the assessment centers, hours for testing. And they cited reduced demand for tests, reduced people seeking tests, primarily because tests are now appointment-based and not on a walk-in basis. I just wanted to get thoughts on that. Do you think that could lead to a further reduction in number of cases reported if fewer people are going to seek a test because of less availability, reduced hours, and things like that?
Well, there's always this possibility, but when we're truly thinking about who should be tested and what the testing protocol should look like, there has to be some consideration given on who is likely to have the disease and who has the symptoms. We talked a lot about the asymptomatic people, asymptomatic cases, asymptomatic transmission. But as we are learning more and more about this disease and we are learning more about the resources that we have in the province or in Canada, we have to make sure that we are using or utilizing all those resources in the right way. So knowing all of that, the provincial direction that we are following right now in Ontario is to do the symptomatic testing or people who are exposed to a confirmed case or a known case of COVID-19 or a probable case of COVID-19. So in all those situations, if there is those risks that put someone at risk, then definitely they should get tested. But for someone who is not even going outside, for example, and are concerned that they have COVID and they do not even have any symptoms, if they want to get tested, they cannot get tested. So I think it's really, if you are concerned, we should get tested and people should get tested. And the hope is, the message is clear. We are closely monitoring those numbers as well. We are aware that the numbers are declining. The test numbers are declining, but it doesn't necessarily mean that people who should get tested are not going for testing. It could mean that people who may be going for testing for various reasons, everyone thinks differently about their own health and about their own risk. So it's just a balancing act. As far as the logistics of taking an appointment versus going walk-in, that is currently being looked at the provincial level as well, because we do feel that this is a barrier and maybe people would want to have the opportunity for walk-in, and how we can achieve that. So I think this is a conversation that's ongoing. We definitely don't want anyone who has any symptoms of COVID to not to go for testing. I think we should make system friendly for them so that they can go and get a test easy. We have heard both sides of the story. Some people want to have that option to book an appointment, go for testing, and then come back. And then there are people who would want to rather have that flexibility for walk-in. So it's just a finding what works best and for individuals. But overall, we want to encourage people, if they have any symptoms, please go for testing. And for those who are directed by public health or who are directed by their healthcare provider to go for testing based on certain risks, they must go for testing. And I think this is something that we have to really look closely and continue to push people who need testing to go for testing.
Thank you.
Any questions from AMA 100?
Dr. Ahmed, just how does it feel looking back at our story? The first case was Friday, March 20th. Since that time, there has been no zero cases. I guess when you and your team got word that it's zero today, just how did it feel?
It felt amazing. My immediate reaction was to text Teresa, and I said, today's a good day, so let's just start off with our happy dance that we said that we should do. But definitely something that we're really happy about, and we don't want to take it lightly. The community has done an excellent job in following all those measures, despite all the challenges, despite all the miscommunication or misinformation that some people are intentionally putting forward. I think our community has come through incredibly good, and we want to see that happening. And again, it's going back, looking at everywhere. We're looking at right now, there is no long-term care home that is currently in an outbreak. There is, at least at this time, there is no farm outbreaks happening. There are minimum number of cases that are happening. So all good sign, and I want to thank the community for that. And we just hope that we keep it that way to keep our community safe, protected, and keep all these economic activity going on. We do not want any lockdown. We do not want any closure, but all of that needs that the community continues to do well, just like we are doing right now.
I guess since that first case back in March 20th, just looking back at the story, is a man in his 60s showing symptoms on March 11th, was tested on March 16th at the assessment center, was travel related. I guess since that time to now, this is the first zero. I guess we've asked you this before, but what have you and your team learned since mid-March to now?
Oh, we have learned a lot. I think if I start to even just saying what we learned, not only from the disease perspective, but even from an operation perspective, what works, what doesn't work, what kind of messaging works, what are some of the follow-up that works. So we have learned a lot, and we will continue to learn. This is a new disease that we're talking about. It seems like forever that we are dealing with COVID, but in fairness, it's just 7 or 8 months of COVID that this world has seen in its full form. And many of the disease existed for decades or even centuries that we are still seeing right now. So there's definitely a lot more to learn. But from our health unit perspective, and I think we've mentioned this a few times, to begin with, our health unit was one of the lowest funded health unit on a per capita basis. We've had limited staffing to do all of that. And the case incidents that our health unit has seen, we had the highest case incidents in the province, and we have reported it many times. So kudos to our team. With the limited number of staffing, with the limited number of resources that we had, we were able to pass through all of that big number of cases that we have seen that no one else in the province has seen, like even what Toronto and some of the other places are experiencing, we experience that. So it's good to see, and again, thank you to our team who has really stepped up their game, and they're coming in every day motivated to do the work. We experienced a lot of criticism. We experienced a lot of we were target of many I don't even want to name it, but there were a lot of pressure on all of us, and I think we learned a lot even just from being in that situation. And overall, it just feels great every day when I'm coming to work here and I'm looking at our cases and what's happening outside. It's just amazing, and knock on wood, let's hope it stays that way. And that's the only thing that makes us happy and keep us going is when we see the result. Both Teresa and myself, I think when we put our head down and continue to do the work, the only comfort that we get is the results, and that's what we are focused on. We don't care about what's happening outside. We don't care about the noise. We are just focused on work as long as we are delivering what we are tasked to deliver for our community. We'll continue to do that job, and looking forward that we continue to follow the trend that we are following right now.
And sorry, one more quick one here. Does this show, and you said it before, there's risk wherever you go, but this just shows that the community follows the safety measures that have been put in place, the masking, social distancing, washing your hands. This just shows that we can battle this virus pretty well.
Absolutely, and I think that's one of those lessons that we want to put forward to people who are just raising all these questions and doubts in everyone's mind that it doesn't exist, it's a conspiracy or whatever. I just laugh at all those posts, and for those people, all I can say is, come on, guys, you're not thinking what you're not. I'm trying to be careful with my choice of word here, but what you're thinking that you have the information that nobody else has, it's not true. It's I think there are experts, and there are experts who have dedicated their training and their education to learn about public health. So please note that these public health is a specialty. It's a Royal College certified designated specialty. If we didn't have public health specialists, then we would have like anyone and everyone talking about public health and taking the responsibility for that. It's not. So there are experts who are making those recommendations, and you can look different countries, how each of these countries behaved. Public health system in Canada is probably one of the best public health system in the world. And that is why you have all those experts here leading this country throughout this pandemic and producing the results that none of the other countries have produced. And so we should be acknowledging that, and we should give credit to all of those people. And obviously, for those who don't think that we are doing a good job, I think the numbers is reflective of what the impact is in our communities, in our province, and in our country.
Thanks, Dr. Ahmed.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. You mentioned that Health Unit is getting a lot of questions when you spoke about travel. Is the Health Unit getting questions from essential workers who say that they're being denied services, or businesses who feel that they should deny services to essential workers?
Yeah, I'll answer from my experience, and I don't know if Teresa wants to add, but yes, definitely we are getting many of the complaints that these essential workers are being denied services, and obviously, a business do have the option to choose who they are servicing, and again at the expense of whatever. But I think what it can lead to is people hiding that information. So we definitely want people to be truthful and sharing that information so that appropriate risk assessments can be done. And if appropriate risk assessment is done and appropriate precautions are followed, their risk is no different than anyone else there then. So then with this way, we are minimizing or mitigating those risks and still continuing to follow the good measures that we are following in our community, because we definitely don't want these people to be, hiding from any of us and not be forthcoming about their potential risk, and lose them in the community, and potentially then they spread it to others. So I think we need to be more open and accepting that yes, there is an additional risk that we have to consider, but those additional risks doesn't mean that they're infected. So I think it's just making sure that, once you are aware of the risk, you are taking all the appropriate precautions and provide them with the service that they need. So, and that can be done. We know that there are, now opportunities for people to get their flu shots in the pharmacies. And then for many, if they are saying that, yeah, they travel, they may potentially fail the screen. So that's when some of those assessment comes in, that you have to know that, well, yeah, you're an essential worker, or if you commute daily, then you're probably not in the same category for someone who just traveled from outside of Canada for a leisure trip. So I think even just making that determination and keeping our community safe, because let's say, for example, for that individual who was supposed to get a flu shot and didn't get the flu shot because declined services, and then say, you know what, I'm not going back again, then guess what, this individual is then, if contracts influenza, then they are spreading it to other people, and which you don't want. So I think it's just finding that right balance and seeing that yes, there is a risk, and I won't say that there is no risk, but making sure that you are following all those appropriate precautions, masking, physical distancing, and everything. You are mitigating those risks, and then the risk will become similar for anyone else who's coming to your clinic. So it won't be any different.
Thank you. And then just looking at the health unit website in the Microsoft IB stats there, looking at the historical graph, it looks like the last time we had 0 cases was March 27th. Would that data would be accurate then?
That is accurate, Taylor, and I think Rob did mention that, and we had that number. Mike, our communication team person, already pulled that information. Our EPI is not in the room, so he couldn't. But yeah, so that is true. Then March 27th was another number that we didn't report anything, but since then, it was just every day we had at least one case. And even in the last few weeks, I think we mentioned that we just barely reported one case, and we were just looking, gosh, it should have been 0. And so today is the day that we're reporting 0 case, so we're really happy about it.
Thank you.
Any questions from Blackburn?
Yes, good morning. Just looking again at the testing numbers. I know less people are getting tested in general, but are we still seeing test results coming back in relative time? I'm just noticing yesterday I looked at the provincial numbers, and they only did 24,000 tests province-wide, and they're usually aiming for 40,000. So I'm just curious if tests are coming back slower, and maybe they're not processing as many in a day, and that's why we're not seeing the big numbers, or if you're noticing anything like that.
So I think it would be, we do provide that number on Friday. Our epidemiologists do that analysis, and I can speak with more certainty there. What I can tell you is obviously our labs, and Teresa is participating in all of those lab calls. Our lab has expanded its capacity. Our London lab that is serving Windsor-Essex, they have expanded their capacity. They do have the capacity to report back those tests. They're always looking for ways to improve the turnaround time. I can anticipate that the turnaround time has gone much better, but I think what I can say with certainty only on Friday when I'm looking at all those numbers. But in theory, they do have the capacity. It's not the capacity issue. I think it's just sometimes it's just the volume, and also how these volumes are arriving at the lab. If one day you are sending, let's say, 2,000 specimen, and then the other day you're just only sending 400 specimens, it just makes it different in terms of how these specimens are processed. Looking forward to it, but I haven't heard any specific complaint or concerns in the last few days or so, but Friday we will present more up-to-date statistics on the turnaround time for these tests.
Okay, thank you.
Any further questions from CBC?
No, thank you.
AMA 100?
No, thank you.
Windsor Star?
No, thank you.
Blackburn?
No, thanks.
Thank you, everyone.
Thank you.